Welcome back. I'm Mike Cal with BD Construction. This week we're going to continue our conversation with Paige Gade. She is an attorney with Rembolt Ludtke, and she's going to share information on the CARES Act and what it means for healthcare facilities.
If a facility has a project underway and there's a portion of that project that is related to exam rooms or strictly isolation, hospital beds, can they separate out the costs of those and utilize these funds to cover those costs?
I would say in most cases that's probably a safe bet. Now it's probably best for everybody who has that question to review those independently with an attorney to make sure that they're in compliance with the HHS terms and conditions that have been released in regard to these provider funds. But considering the fact that I've mentioned previously that they're for healthcare related expenses or lost revenues attributable to coronavirus, including building or construction of temporary structures, retrofitting facilities. So I would think that those types of projects would seem to fall squarely within that definition of what the funds can be used for. And I would encourage providers to keep good records of how these funds are being expended. Audit is always a scary word, but in the event that the Secretary of the Department of Health and Human Services were to audit, that would be the question they would ask is how were the funds spent? And so to the extent that you can keep detailed records on exactly where the provider relief funds went, that's going to be a safe bet. And if you can prove that, these negative airflow rooms were part of the coronavirus response and necessitated by the coronavirus response, then I would guess that that's a pretty safe bet. But again, it's always good to consult with an attorney on specific questions.
Sure. Are there any additional relief funds that are out there to help with uninsured type individuals, or did the government fund any of that?
Sure. So providers may request reimbursement for treating uninsured patients who have COVID-19. There's a couple different ways that was funded, but there's an online portal that a provider can go on and request reimbursement for testing or treating patients with COVID-19.
Are there any other programs out there available for the rural areas that may be part of either the CARES Act, the HEROES Act, and or any other act that's been passed?
Sure. So similar to the provider relief funds, there are funds that were earmarked for rural providers specifically to provide additional funding for them. And so those would have been deposited similar to the provider relief funds. And again, there's two different sources. There's the Rural Testing Relief Fund that provides additional funding for testing, and then the Rural Relief Fund that is more geared towards the treatment of COVID-19 patients. But those funds are both available under the CARES Act and were deposited with designated facilities in rural areas.